Let's talk movements of the spine. The textbook doesn't do a great job of demonstrating these things, so I'm going to show you in the video to hopefully clear this up. So the spine motions are flexion, extension, lateral bending or lateral flexion, and rotation. These are all different at the segments of cervical, thoracic, and lumbar. And then other things can contribute, like pelvic tilting can help increase flexion or extension. Also, a lot of things contribute to this. Our posture, which has to do with our muscles and the muscle imbalance. So if you have really tight anterior muscles in the front here in the chest, then we're going to have really shortened muscles in the front and lengthened muscles in the back. And that is going to impair our ability to move and a lot of things. So when you get into these careers, what you will find is that the injuries that we talk about in this module, which are like actual injuries from forces and loads, are typically not the bulk of the injuries that we will deal with, especially when we're talking about athletes. It actually has more to do with mobility and increasing mobility of the spine and increasing overall gross movements of each of the synovial joints, which a lot of times attributes to muscles attaching somewhere on the spine and being tight or overworked or overused or not stretched out appropriately. So first we need to understand what these look like. So flexion is going to be anteriorly moving, and extension is posterior movement. So extending back and moving back. So when we talk about extension, we can extend the cervical spine. There's more flexion extension at the cervical spine and the lumbar spine than there is the thoracic. Also remember that the ribs attach at the thoracic vertebrae, so there is some of that constrains some of that movement. But when we talk about extension, we look at what kind of injuries happen from extension. Extension is going to cause a lot of compression of the vertebrae. And also it can, if there's any kind of nerve pinching or stenosis or narrowing of these canals, that is going to really cause nerve injuries. Flexion, on the other hand, is opening up the nerve canals here, but creating a lot of compression on the disc. So one of the things that we would look for when I worked in the spinal rotation at the Stedman Clinic is the grocery cart sign. So in older people that started getting nerve compression in their back, they would just want to ride on a grocery cart and put their arms on it and walk around like this, because it opened up the posterior spine and allowed more opening of those canals and took pressure off their nerves. And then when we talk about lateral flexion, we're talking about bending to the side. So this is lateral flexion. And then we have rotation. So rotation, when we talk about this from a standpoint of what a patient looks like when we're doing that, what we're looking for, a lot of times what we're looking at is cervical, because we want to know, especially after concussion or some kind of head injury, we want to know if the spine is involved or if there was some kind of injury here, because any kind of injury to the neck compromises potentially the stability of the spine, which then compromises the ultimate stability or the safety of the spinal cord. So when we talk about flexion, when we're looking at them, we say flex. I want you to look down at the ground. And now we want to look at extension. I want you to look up at the ceiling. And then I want to do lateral flexion. So I want you to bring your right ear to your right shoulder. And now I want you to bring your left ear to your left shoulder. And then rotation, I would say I want you to look over your shoulder. And make sure that we're not combining motions, because we can rotate and lateral flex and extend. And then we start getting into those. And that's important to assess too, but we want to assess each one individually. When we're talking about the whole body, when we talk about flexion, we also want to take into account that there's cervical flexion and then there's lumbar flexion. And then if I tilt my pelvis, then I get a whole bunch more of flexion. So when we touch our toes, it's not just flexion of the spine, it's using our pelvis, anteriorly tilting and then flexing forward. Same thing applies to extension and tilting the pelvis and then extending even more to get that hyperextension. And then same thing for rotation. You can rotate just your spine when we're rotating, and then our neck has much more rotation. And then you can also throw in the rest of your body, your muscles and your shoulder, and do that as well and compensate, as well as your pelvis. So make sure that the movement is coming from the actual segment, the spinal segment. And then we start getting into what is restricting it. Is it a ligamentous issue? Is it a bony issue? Is it a muscular issue? It's usually a muscular, more of a gross type of tightening that prevents some of that motion. If you have any questions about what these different motions look like and how we would look at them in someone, then please reach out.